What is neuralgia? Symptoms, causes, and treatment of this disease. Interesting about science and medicine. Prepared by editors of a page, all scientific. What is neuralgia? Neuralgia is pain that is caused by an inflamed or irritated nerve. Duration of neuralgia. Neuralgia, pain that travels along nerve pathway, can be temporary or chronic. Neuralgia can be different, mild to unbearable intensity. How does trigeminal neuralgia manifest itself? Trigeminal neuralgia, by the name of a nerve, is characterized by lightning pain in the face. What category of people does trigeminal neuralgia be observed? This disorder most often occurs in people over 50 years of age and occurs 3 times more often in women than in men. What is sciatic neuralgia? The gluteal or lower extremity nerves are also very vulnerable. For example, inflammation of a sciatic nerve can cause neuralgia. What is postherpetic neuralgia? Another form of this disease is postherpetic neuralgia, which occurs after a herpes infection, shingles. Postherpetic neuralgia is accompanied by a feeling of continuous burning. Signs of neuralgia. The main symptom of neuralgia is pain along the trajectory of a nerve, which can be sudden, acute, similar to a burn, or sometimes accompanied by a burning sensation. Hypersensitivity on touch, itching. Neuralgia occurs in certain area of the body and is usually one-sided, unilateral. What can be neuralgia? The pain may be constant or intermittent. In other words, it can last from a few seconds or minutes to several days or weeks. When to see a doctor for neuralgia? If you suspect that the source of a pain is a spinal disorder, herniatic disc or nerve compression, if the pain is unbearable, perhaps the patient has damage at the nerve level, if facial neuralgia expands toward the eye after an episode of herpes, if the disease is not treated, the patient may become blind. If signs of illness include impaired anal and urinary sphincter control or leg tugging, these symptoms are an indicator of nervous system disorders. The patient should immediately call a doctor. Causes of neuralgia. The most common cause of neuralgia is inflammation, musculospinal injury, blood vessel compression, or viral infection. Reason 1. Injury of a muscle or spine. Nerve compression can result from injury to a muscle or spine, herniated disc, or due to long-term bad posture. Reason 2. Compression from the side of a blood vessel. The source of a pain in trigeminal neuralgia may be compression from the blood vessel. Viral infection. Reason 3. In postherpetic neuralgia, the cause of nerve inflammation is a viral infection. Still, in many cases of neuralgia, the causes of the disorder remain unknown. Analgesics for neuralgia. Often doctors prescribe analgesics for patients with moderate form of a disease and opioids for severe neuralgia. Anticonvulsants, anti-epileptic drugs for the treatment of neuralgia. Pain resulting from trigeminal disease can be managed with anticonvulsants, anti-epileptic drugs, such as carbamazepine, phenytoin. Ointment based on capsaicin for postherpetic trigeminal neuralgia. For postherpetic trigeminal neuralgia, an over-the-counter capsaicin ointment can be used. Corticosteroids and sedative for neuralgia. Corticosteroids reduce nerve inflammation and psycholeptic sedatives help relieve pain indirectly. Manipulation with the spine and soft tissue to eliminate neuralgia. A chiropractor or an osteopath can help relieve pain. Thus, spinal and soft tissue manipulation can be very helpful in alleviating many types of disease. Acupuncture. It has been found that acupuncture can be very effective in treating neuralgia. For acute pain, about 5-10 acupuncture sessions may be needed. Physiotherapy. In a few lessons, a specialist in the Alexander method will be able to teach the patient how to adjust the body and how to move in order to avoid future attacks. Deep massage. Deep massage reduces the feeling of pain by progressive exploration into the depths of muscle and connective tissue, concentrating on cleansing a specific area of the body. When inflammation creates area of increased friction or compression at the level of a muscle or fascia which cover the muscle, musculofacial therapy corrects this abnormality, which reduces pain. A decoction of St. John's wort. A decoction of St. John's wort prepared from 2 tablespoons of this plant per cup of boiling water helps with this disorder. Leave and infuse for 10 minutes and take 3 times a day. This remedy has good analgesic properties. Black cohosh extract. Black cohosh extract is characterized by anti-inflammatory action. Vitamin B6 in case of attacks of neuralgia. With attacks of neuralgia, vitamin B6 may be useful. To do this, the patient should take a maximum dose of 50 mg in 3 sessions per day and other B-complex vitamins once a day. Vitamin B6 intake should be limited to 1 week. Vitamin E in postherpetic neuralgia. If the patient is dealing with postherpetic neuralgia, vitamin E 400 mg per day should also be taken. Good source of are avocado, soybean oil, sunflower oil. Oatmeal. Consumption of oatmeal can improve the nervous condition of a patient with neuralgia. And rice is very useful. A drink made from rice straw or rice grass is an excellent tonic. In order to eliminate itching with neuralgia, it is recommended to use a bag of rice during the bed. What can be done with neuralgia at home? A man who suffers from trigeminal neuralgia may grow a beard to protect his face from the cold that can sometimes cause an attack. Cut a baked potato in half and place the resulting halves on a sore spot to relieve pain. Prevention of neuralgia. Learning proper position while sitting or standing and lifting weights properly can help keep your spine healthy and prevent neuralgia. Certain exercises can help prevent seizures. To do this, consult an experienced physiotherapist. Thank you for your attention. This material was prepared on the basis of a page all scientific. This video is provided for information proposal only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.